We now continue our discussion in the section Children on CKD, and the topic of discussion is rare disease and genetic testing. To give us more information on this topic, we have with us Dr. Sukanya, a pediatric nephrologist from the city of Chennai. And she will be discussing with us what are the rare disease in genetic testing, why is it important, and is there reasons for genetic testing not to be done by families? Please, wherever you are this afternoon, put your hands together and welcome Dr. Suganya.
Thank you, Marianne, and thank you, Kidney Warriors Foundation, for asking me to speak on this poorly understood and also a topic which has many fears and myths about it, about genetic testing in rare kidney diseases. So in the next few minutes or so, I'll take you through what are genetic tests, common kidney disease could be affected by the genetics, and some clarity on why we do genetic tests. What can genetic tests tell you, what they can't tell you, and what are the major factors that prevent us, or that puts up that most of us hesitate, or parents sometimes hesitate to do genetic tests. So we'll be speaking about this in the next few minutes. What are genetic kidney diseases? So almost close to 100 number of kidney diseases, almost more kidney diseases can have underlying genetic basis. The more we understand about genetic tests, we are realizing that more and more kidney diseases can have a genetic background. They can vary from the commonest of conditions like renal stones to rare disorders that you've never heard of, or only which affects very few children, 1 in a million population. They can also, less severe kidney diseases can have a genetic basis, and also severe kidney diseases can have. Genetics can, having a genetic abnormality can also either result in a structural problem, that your kidneys can look different, say on a scan or on a CT scan or an ultrasound, or they can look completely normal on the imaging but can have functional problems. So genetic diseases can both cause structural and functional problems together or separately also. And also they can only affect the kidneys, and sometimes as with a single gene can have many functions across the body. So some of these genetic disorders can not only affect your kidneys, can go on to actually affect more than one organ, including your kidneys. So how do these faulty genes cause disease? So many of us would know that we all have made up of many different types of cells. And within these cells, there's something called the nucleus, which carries the genetic print of the genetic makeup of us, which is condensed into a structure called the chromosome. So these chromosomes, we have 23 pairs of chromosomes. So total number of 46 chromosomes. 2 of which would be called the X and Y chromosome, which determines whether we are males or females. So there are 23 pairs of chromosomes into which is written the detailed genetic code of each one of us. And that genetic code is something called the DNA. So this DNA finally translates into, finally produces the genes in the DNA, produces something called protein. So these proteins are multitude. There are so many number of proteins which has a unique function in our body. So there are many proteins within the kidneys itself, and the kidneys is made up of so many of these proteins. The kidney structure is called, the units of kidney, which we call the nephron, again is contained into different parts called the glomerulus, tubules, and your interstitium, and so many other blood vessels and all of that. So each of these, how they are made up and how they function, how they look, is determined by the DNA and the genes containing or in the DNA. So whenever there is a fault in the DNA or in the genes, they result in an abnormal protein, and this abnormal protein can finally result in an abnormally looking kidney or an abnormally functioning kidney. So this is how the genetics, the faulty genes would cause a kidney disease. So moving on, how is genetic disease passed on? So we all know that genetic disease is something that you're born with. So how does it pass on from one generation to other? It can pass on in many different manners. And for something, first of all, you should understand who are first degree relatives. So first degree relatives are somebody who's your parent, with your children, you have your brothers and sisters who are born with you. So all of them would come under the category of first degree relatives. And the second degree relatives being grandparents, aunts, uncles, nieces and nephews and grandchildren. So most of the genetic diseases are either directly passed on from the first degree relative to you, or sometimes it can skip a generation. And so sometimes we might be asking you in our clinic when we are dealing with a child with genetic disorder, we might be asking, are there any aunts or uncles? Are there any cousins getting affected? Are there any nieces and nephews having the same problem? So that is why we are bothered about this detailed family history. So many of these genetic disorders, at least you will need to know how many of the relatives in the first and the second degree are affected by the same disease. You might also be hearing words like autosomal dominant, X-linked dominant recessive. So this is what it is. So autosomal, we all know that we get two sets of genes from our parents. So one set from the mother and one set from the father. So not all diseases require all the genes to be faulty, like the two sets need not be faulty. Some diseases can be manifested even if one copy of that gene is faulty. So that is called autosomal dominant. When you need both the copies to be damaged or defective, that's when you call it as autosomal recessive. The X-linked manner in which the diseases are passed are linked only to the X and Y chromosomes. So if the disease is passed on only through the X and Y chromosomes, so then we call it X-linked dominant or recessive. So which are the kidney disorders, especially in the context of a chronic kidney disease, that one should be aware of or one should know of is these. The most common genetic disorders that we come across in clinical practice in children who go on to develop renal failure are these. The autosomal dominant polycystic kidney disease. This affects both children and adults, more in adults because you acquire this as a kid, you are having this genetic problem, but the disease sort of manifests later in life. But that remains one of the commonest genetic diseases that we see. The other diseases, cystic kidney diseases, are autosomal recessive polycystic kidney disease, and another group of disorders called nephronophthisis. Some children might have this. The other syndromes are Alport syndrome, which can, as I said, some of these disorders can affect organs other than the kidneys also. So they can affect the kidney, ears, and eyes. Nephrotic syndrome, which is a common condition in children. Not all of them have a genetic defect and go on to develop chronic kidney disease, but a few of these disorders, congenital nephrotic syndrome and some genetic conditions which can produce a disease called focal segmental glomerulosclerosis, all these can result in chronic kidney disease. There are some tubular disorders which can result in, kidney failure and need for dialysis or transplant. These are less likely to cause, but we do see some children having these disorders and ending up with chronic kidney disease called the Bartels, the Gentleman syndrome or cystinosis. And also renal stone disease. Many of you would know that renal stones can occur in adults, but renal stones is a well-known problem in children too. And often in children, when renal stone occurs, it's because of an underlying genetic disorder. Some of these, majority of these renal stone disorders, we have treatment and we have treatments to decrease the stone load. But there are some disorders like hyperoxaluria, which do not have treatment currently and end up in kidney failure. And these children end up needing transplants in the longer run. So what can genetic tests tell you? So when we suspect any of these conditions that I've just now described, and we have a family history of kidney disease, or there are more than one organ involved with along with your kidney failure, then those are the conditions where we start counseling the parents about the need for a genetic test. So in that situation, the genetic test can be ordered by your doctor for any of the particular reasons. It could be because we want to make a diagnosis, take important decisions. So we want an accurate diagnosis sometimes to make important decisions based on for treating the disease. So whether we have treatment for a particular condition or not, prognosis, wherein we tell you what to expect in this disease or not. So for making all these treatment decisions, we need an exact, accurate diagnosis. Sometimes renal stones, you can have hundreds of diseases causing renal stones. Not all of them are very severe. Not all of them have treatment, and not all of them can be undergo a straightforward kidney transplant. So it's just an example. So like this, to make a diagnosis, we need a diagnosis to make a concrete treatment plan, prognosticate the patient, the parents about the disease, and also sometimes to decide on whether these patients are amenable for a transplant. And sometimes we want to rule out certain rare disorders. It looks like a rare disorder, but there are plenty of reasons why the child may not have that disorder, or the plenty of other causes that can cause a similar picture. So we might want to rule out certain genetic conditions, so we might ask for a genetic test. Sometimes there might be a family history of a renal disease, and we might want to assess your child for the risk of that particular genetic condition. Sometimes we know that this is running in family and it can be passed on. So what is the risk of this disease being passed on to the next generation? So for that also, we might ask for a genetic disease, for a genetic disease screening. And the other thing is also before birth. So sometimes there is one child in the family who has a particular genetic kidney disease, and the mother is pregnant, and now we want to tell them how likely the coming child is likely to have a disease. So sometimes we order a genetic screen even before birth, or we do something called a pre-implantation genetic screening. So that is after pregnancy, in very early pregnancy. So these are some of the information that a genetic test can tell you. So how are genetic tests done? So when we say genetic test, what do we actually mean? So genetic test is usually performed on a blood sample. So most often it's only on a blood sample. So we take some 3 to 5 ml of your blood sample for a genetic test. So that's all it is needed. So depending on the suspected problem that we have, that we anticipate in the patient, we might look at only a few genes that are more likely to cause the clinical disease, or we might even get your whole genome tested if the conditions that we are thinking are very broad and there are too many conditions that can cause the same type of presentation, then we might ask for a whole genome testing. So the first part of the genetic test is coming and collecting information about the patient, the family history of the patient, and what all tests are available so far. All these information is passed on to the lab along with collection of the blood sample. And then usually the time that is taken for processing this and for coming out with the report is usually 4 to 6 weeks in India currently. This is also such time delay is also there in Western countries too, because genetic testing is not done in every single hospital. Usually there are hubs which do these tests, and only few centers take up genetic diseases and do this reporting. So the analysis is the next part. So that takes anywhere between 4 to 6 weeks. And then the third part is actually these reports are not easily readable. So not everybody can understand these genetic reports. So often we look at the reports, we work out what the genetic report actually means to the patient and to their family. And then in either the doctor themselves or in a discussion with the genetic counselor will talk to you about the results and what it means for you. All right. So this is how genetic testing and reporting is done. So although we, as I said, genetics does help us in accurate diagnosis in most of our patients, especially when there is a familial condition or when there is a condition which affects many organs in your body. In truth, the test acceptance rate is very, very little. In my practice, out of the 10 patients, I would suggest genetic tests, close to 2 to 3 only get it done. We do often discuss about why we need these tests and how accurate these tests are and how these and what will change with getting these tests. But sometimes there are many fears and hesitation from the parents to accept these tests. So one is a very common fear that we find of finding who passed on the disease to the child. Is it from the mother side or it's from the father side? So this is often a major hindrance for parents to go ahead and accept the genetic tests. We have sometimes come across marital conflicts due to blame. We do advise them that it's not, it's not a hard and fast rule, or we need not look into that, blame game. We do advise parents beforehand this, but then we sometimes end up with situations like this. And sometimes unwanted information about paternity and adoption can be revealed by ordering a genetic test. The other disadvantages or sometimes the problems with genetic tests is not every time you have a positive genetic test, and sometimes even when you have a positive genetic test, it might not correlate with the disease that we have at hand. So sometimes these results are not clear, and parents might it might upset parents that even after going for the for a test that is supposed to be accurate, you're still not having the answers that you want. So that might be upsetting sometimes. And the results of genetic testing, this is a very valid point that many parents do face. The results of a genetic test might affect medical or life insurance policies. Often life insurance policies do not genetic diseases. So once you reveal that you have a genetic disease, the medical insurance might not be, you might not claim in all conditions. And often, even though the genetic test sometimes gives an accurate diagnosis, there is not treatment yet available for all of the genetic diseases that we discussed. Some of these diseases, we can only give you the diagnosis and sort of tell you what to expect, but we don't have current treatment. So it might not actually lead on to a change in treatment plan for your patient. The costs of the tests, in the last decade or so, the cost of the tests has come down so much. It used to be in the line of 50 to 60,000. Now it's around 15 to 20,000. So the cost has definitely come down, but still this cost is out of pocket expenditure, and it's not majorly covered by some of the insurance schemes that are available. So it might be the cost still remains to be a deterrent, especially in the lower and lower middle economic class in our patients. And of course, the long waiting times, as I said, there's 4 to 6 weeks delay. So for immediate treatment and immediate response, this might not be the best test that's available. My final summarize what genetic tests can and cannot do and why should you do. Patients' genetic tests currently are cheaper. They are being available widely. They also can give accurate results to in most of the patients that we see in whom we suspect genetic kidney disease. In many conditions, we are able to, these genetic tests are able to guide us for correct treatment, for correct prognostication, assessing their suitability for transplant. There are still some areas that we don't understand about genetics. There are still some places where we can improve on the cost, on the faster delivery of these results. But nevertheless, genetic tests have added a huge diagnostic ability to our in dealing with our patients with kidney disease. So I think in these the last few minutes you have listened to this points being put forth and understand about genetic disease and able to dispel some of your fears and myths about your genetic disease. Once again, I thank Kidney Warrior Foundation and Marianne for asking me to speak on this topic. It's been my pleasure. Thank you.
Thank you very much, Dr. Sukanya, for so beautifully covering that complex topic on rare disease and genetic testing.